and welcome. My name is Caroline McGraw. I'm here with The Clearing, and I'm thrilled today to be speaking with Maia Szalavitz, one of the premier American journalists covering addiction and drugs. And she is the author of several best-selling books. She also writes for Time.com, for Vice, The New York Times, and other top publications. And today we're talking with her about her book, Unbroken Brain, a revolutionary new way of understanding addiction. So welcome, Maia.
Thanks so much for having me.
You're very welcome. We're glad we got to do this interview. And I just also want to say how much I enjoyed reading your book. Have it right here. So thank you for sending that along.
No, sure.
So diving right in, Maia, you went from life as a gifted Ivy League student to a life of using cocaine and heroin up to 40 times a day. How did that happen? What were some of the underlying issues that were really driving your drug use?
Sure. Well, I was always a very weird kid, and I felt very socially isolated from very early on. I just had sensory issues, so that lights were too bright and sounds were too loud, and I overreacted emotionally to a lot of experiences, and so that made me a great target for bullies because I would always react. And I just also, it's hard sometimes to be a smart kid because the other kids aren't interested in the same things you're interested in. And if you're especially obsessive about the things you're interested in, that can be a serious problem. So what ultimately happened was I discovered that, unlike science fiction or opera, drugs were an obsession that other people were actually interested in. And so when I got interested in psychedelics, partially because, I was like, wow, these can alter your consciousness and allow you to feel connected to things. And I sort of read the electrocholine acid test and all this stuff about the 60s. And I was like, oh, that sounds like, yeah, I want to be a part of that. And then actually taking psychedelics, I began to have friends, and talking about psychedelics made me seem like an expert, and people wanted to get high with me. So, so that was where it started. And if I had sort of stuck with the traditional hippie advice of ignore the white powders and don't touch them and never shoot anything, we probably wouldn't be sitting here, but I would have a very different life. But I unfortunately did not. And, in the 80s, it was one of the cocaine decades. Like, we tend to switch every 10 years between stimulants and depressants. So you got like 70s heroin, 80s coke, 90s heroin, O's methamphetamine, 10s opioids. But so the 80s were cocaine, and it was very hip and very popular. And I did it, and I felt like, I'm cool. I can get into the cool clubs because I have it, and people want me to come to their parties because I have it. And it just like allowed me to feel socially included. And then I got suspended from school because I was selling it, and that was a disaster. And so I thought my life was over. And then I said, well, I may as well try heroin. So this was all not very good reasoning, but, what happens when you are a person who has some kind of outlying neurology or outlying temperament, you find stuff that actually works to make you feel okay. You are inclined to do things that you would not otherwise do, in the same way that somebody who falls in love with somebody will be inclined to do things they might not otherwise do, just to keep that relationship going.
Sure.
So that is basically the short version of what happened.
Thank you for sharing that. And I love in your book, you write, I was in general terrified of other people. I used drugs for emotional protection and for social comfort. And I think so many people can relate to that because there's obviously, epidemic drug use and so many people struggling with social anxiety. And so just highlighting that connection that, we're going to talk about trauma, we're going to talk about some of the other issues later on, but that social anxiety alone can be a huge motivating factor.
Well, and I think particularly with opioids, like the opioid system in the brain is there to make socializing rewarding. It's there so that you love your mom and your mom loves you, and all that good stuff that happens with stress relief between mom and baby, and dad and baby, and lovers eventually, and friends. All that stuff, basically when you create a social bond with somebody, you're wiring your opioid and dopamine system to that person. And so when you have that person, you will actually creating that, especially if you were deprived in the first place, for whatever reason it may be, that's really attractive. And right now we're in a cultural moment where everything is scary. We have a fraying social network and rising inequality, all kinds of stuff that makes us less connected to each other. So yeah, people are doing heroin. It is not a good thing.
But yet it makes sense given some of the context. Exactly. Yeah.
I really feel like one of the most important things I want to get out there is that, drug use and addiction in particular is not about the drug. It's not that I was like this extraordinarily hedonistic person who just wanted some extra pleasure, and then I gave up everything for it. Like, why would you do that? Like, if you had a life that you felt comfortable in, almost nobody does that. Like, virtually all people with addiction, something is going on.
Yes.
And if you look at, for example, you don't get a story of, I was happily going along my life. Everything was nice. I had a great husband. My kids were fabulous. My job was amazing. I felt truly good about myself. I was exercising, I was eating well. Everything was fabulous. And then I tried this drug and I decided, I'm going to give all that up. What tends to happen is, first of all, with opiates, actually only about a third of people really, really like them. And among that group of people who actually like them, the rest of them are like kind of or they really hate them because they make them nauseous and numb. But among that group that likes them, if your life's in good shape, people are basically like, wow, that was amazing bliss and euphoria. I better not mess with that stuff because I'm going to mess up my life. But if you don't if your life is already messed up, that's where the danger is.
Yes, that's a perfect way of describing it. And I wrote another quote from your book. You're talking about addictive behavior is not the root of the problem, it's more like a symptom. And that addiction is often a search for safety rather than an attempt to rebel or a selfish turn inward. So I think that's what you're highlighting here. You're searching for something. Yeah, there's an unmet need.
No, exactly. And I mean, the people who take drugs as teenagers basically to tell their parents to F off, those people often are not addicted people. Some of them may develop addictions, but a lot of them, it's a symbolic way to piss off their parents. And if not doing that, or if, they start growing up, that's that, they're over it. But for people who it serves a deeper purpose, that's where, you get the problem.
Yes, exactly. And that's a great transition to the theory that you put forth in your book, which is that addictions are not the result of broken brains or addictive personalities, but rather that they're a kind of learning disorder, that it can be categorized as a developmental disorder. And can you share, how did you come to that, and what are the components of that theory?
So basically, when you look at developmental disorders, and I was interested in this because I basically, as a kid, would have been diagnosed with Asperger's syndrome if that had existed as a diagnosis at the time. But so I got interested in that whole area, and there are certain things that really young, like in little kids, you don't generally see schizophrenia at that time. Don't see addiction at that time. You do see addiction very, very strongly in the teens and early 20s. Like 90% of addiction starts at that time. That is actually a very critical period for brain development, because what's going on is you are developing these networks that allow you to fall in love, to parent, to be an adult. And these bonding systems are actively developing. And the sort of system that's going to get you away from your parents and out into the world is developing. And that's developing before the stuff that puts on the brakes and self-control and all that other good stuff. So you get a racing engine and not so great brakes.
Ah.
And a lot of times people, this is a surprise to a lot of people, but the majority of people with addiction actually outgrow it without any self-help groups, without any treatment, without anything. They just kind of get to a point where it's like, oh, this just doesn't work. I better put this down. I got a kid now. I got married. I got a job, whatever. A lot of people stop before they're 30. And that is interesting because that brain development, by age 25 or so, you're starting to get the controls on. And once those are there, it's a lot easier to be able to manage recovery. So part of a learning issue is that it comes on at a specific time in life. Also, the thing with addiction that is really fundamental is if you don't learn that the drug fixes you, you don't know what to crave, so you can't go get it. Like there's people who will come out of the hospital physically dependent on an opioid. They don't know it. They feel a little nauseous. They feel a little out of sorts for a couple of days. They have no idea that they're undergoing the holy terror of withdrawal because it is a holy terror for them because they haven't fallen in love with the drug. They don't know what they. And so they're not going to go randomly, oh, I think I feel like today squirting heroin for some reason. No, that doesn't happen. What happens, if you don't know what to crave, you can't go and take it compulsively despite negative consequences. You have to learn that the drug is the thing that works for you. And then you have to persist despite negative consequences, right? That's the DSM and NIDA definition of addiction. So it's like, you have to have compulsive behavior despite negative consequences. And negative consequences is basically a synonym for punishment.
Yep.
So basically, you're not learning from punishment in relationship to the behavior around this thing. And that's an evolutionarily good strategy if it's taking care of your kid or staying with your partner. It's not good if you're in love with a drug. So basically a system that learns to set your priorities in order to survive and to reproduce, that system goes awry in addiction. And that is a specific difficulty with a specific type of learning in relation to a specific experience. And other learning disorders like dyslexia, for example, it's very specific. It's just about and now I'm not going to, I'm not going to precisely describe it at the moment, but it's not about general intelligence.
Right.
The that people with dyslexia can be brilliant, and yet they have this one specific issue. And most learning disorders are like this. Similarly, autistic people, often brilliant, but they have this social thing.
Yep.
Also, people with ADHD, lots of different things. You have a problem with this one thing, but the rest of the thing is working fine.
Yep.
And so that again suggests, okay, this is a very specific learning disorder. And, sort of understanding this to me was a revelation because it's like, wow, how dumb is this? We've been using punishment to try to treat a condition that is defined by its resistance to punishment. Like, what?
Ooh, yeah.
Why would you do that? And so, so I got interested in that. And then when you learn the history of our drug laws and you see the utter racism and complete lack of science in them, you have to understand why that occurs. But, it's like sort of once you get that and once you get that really is the essence of addiction, then you cannot support our very stupid and cruel drug policy.
So that was going to be my next follow-up question. So talking about addiction and recovery, and how does this model change the way we look at treatment?
Sure. So basically, treatment that is punitive, shaming, humiliating, unattractive is not good for addiction. It is not good for children. It is not good for anything.
Yeah.
Those tactics are not to be used in medical care. They do not help. They do a tremendous amount of harm to people with addiction. So and all of those tactics are aimed at making you hit bottom and experiencing consequences and all this stuff like this, because clearly the problem is that you just haven't suffered enough yet. If you are willing to persist despite negative consequences to get your drugs and you lose your house and your car and your friends and everything else like that, why is another punishment going to help? It is not. So we've got to get rid of these kinds of shaming, humiliating, disrespectful kind of treatments. That's like the first lesson here. The second one is that if you have a problem with learning specifically, it's not like your brain's broken. You know, when you fall in love with somebody, yeah, you're going to feel sad when you break up, and it's going to be an awful experience sometimes, and you are going to, you know, feel like you lost everything for a while. But your brain isn't broken, and the fact that you have these strong, powerful associations with that person is not a error. It's just that that's what happened. That's what you learned, right? So you learn something that's problematic in a system that makes learning very deep and hard to undo.
Yes.
So, you know, I think this is a helpful view also because if you see addiction as this specific learning problem, you don't have to be like, I'm damaged, I'm diseased for life, I'm never going to get better. Like, you know, this is always going to be a chronic, painful problem for me. Now, that will be true in some cases, but fortunately, most people can get over a horrible breakup with a drug or with a person. And that gets more difficult when you are talking about a person whose life is in bad shape. So if we want to help people recover, we have to do things that give them a life worth living. And that involves having a sense of meaning and purpose and having connections. And that's going to be very, very different for different people. Like, there are some things that other people are interested in that I can't imagine why it would not give me a sense of meaning or purpose.
Yes.
The things I'm interested in would bore the hell out of a lot of other people. So, you know, we need to, just as like the way you get over a breakup is really individual, the way you get over addiction is going to be really individual. And you need to figure out specifically, okay, 50% of people with addiction have another mental illness. And that basically shapes their temperament. So you might be kind of aspy and have social difficulties and anxiety. You might be depressed. You might be both. You might, you know, have bipolar or whatever. Those things need to be dealt with. You need to feel comfortable in your neurology. So you need medication for that. You might need meditation for that. You might need exercise. You might need a partner, or you might need a cat, you know, whatever. But you need to figure out a way to live comfortably in a very narrow, miserable life. And who wants that? So, you know, we need to find these things for people. Oftentimes it's a job, you know, it's just, so, I mean, and this is why, like, we get into this whole debate over the 12-step thing. Because some people really do find fabulous meaning and purpose in that program. And we should not discourage that.
Sure.
My view with that is just that it shouldn't be sold to people as professional health care. Because that way you're paying for something that's free, which is dumb when you have limited resources. And you are also violating the program's own traditions by paying for something that should be voluntary service, which has a very different meaning if you're doing it that way. And also you're crowding out treatment that works for other people. And, you know, the rehab and treatment centers should be focused on teaching people how to avoid relapse, how to cope with whatever mental illness they may have, how to deal with any kind of trauma they may have, which 2/3 of people with addiction have some kind of childhood trauma. And so, again, that is going to change your neurology profoundly. If you have trauma in early life, it wires you in a way that your stress system changes and is overreactive or underreactive. It can be a lot of different things. But when that happens, again, you're not going to feel very comfortable. And an opioid or a stimulant, depending on which type of trauma and how you respond to it, those things may be very powerful for you. So you, again, need another way to deal with that and to, you know, feel safe and comfortable. So treatment should fundamentally be very individualized. Cognitive techniques to deal with these particular things, whether it's impulsivity or depression or anxiety or whatever it is, and dealing with trauma. If you do those and you get somebody safely through the most difficult transitional period, then, and you they have a life to go to, something to live for, that's when we see recovery happening. Now, it's really important. Oh, I see the kitty.
I was going to say the cat is photobombing.
uh, it's really important for people with opioid addiction, particularly, to realize that the only thing we know of that cuts the death rate by 50% or more is sustained maintenance with either methadone or buprenorphine. And in an environment where there is all this fentanyl out there and where there is all kinds of crazy stuff and insane overdose rates, we need people to have that protection. Now, this is not to say years till they really stabilize, till they really learn stuff. And if they've been on for a couple of years and they feel safe and comfortable and all's well, why come off? Like, I am on Prozac. I'm going to stay on Prozac. I don't care. It works. Like, I don't want to feel depressed again. Like, why would I? Like, it's not having bad side effects. So, so I feel like it's really important to have people realize that these medications save lives and that what we've been taught about them is wrong. And that you're not always high. You're not really in recovery. These things are really useful. If you're having bad side effects, if the program you have to deal with is a horrible pain in the butt, there may be reasons that you want to come off, but don't do it because you're stigmatized. Fight the stigma.
Yes, so many good points. The whole time you were sharing, I just felt like, oh, you're speaking our language, because as viewers probably know, we're focused on dual diagnosis treatment. And so looking at the anxiety, the depression, the trauma, all of those things, that's our focus 100%. And I loved in your book, you talk about the amount of pain and heartbreak that typically precedes addiction and how trauma can be a critical factor in its development. And one of the things that blew my mind when I first started learning about this was just the idea that there's a medical, physical definition of trauma, but the emotional, psychological definition is entirely subjective. It's what was harmful to you personally, and hence your point about the individuated treatment. It has to be personal.
Yeah, and one of the things about the fact that humans are wired very differently is that, an experience that might be utterly trivial to you could be completely traumatic to me. And, that's just how it is. Some things sensitize some people's nervous systems and other things sensitize other people's nervous systems. So it's really important to not trivialize people's experiences and to really just help them feel comfortable and safe. Like, what treatment should be is, like, imagine like you have like a horrible disease like cancer or whatever, like, God forbid, but if you had that, you would want to feel safe and protected, and you would want people around you who cared about you, who weren't being jerks to you, who weren't like yelling at you, it's all your fault and you horrible stuff. Like, how is that going to help anybody? Like, so much of treatment for so long has been so awful, and then we blame people with addiction for not seeking treatment because they're just having so much fun.
Right. Right, but who would want to go to such a punitive treatment? Yeah. What's the motivation? And as you said in your book, you shared that from before first grade, you already felt this sense of badness, like you were a bad person, and add years and years and years of that for so many people. Yeah, you don't want any more punishment.
No, well, it's also like, I don't know what it is. Like, my father was a Holocaust survivor. Like, obviously there were issues going on that might tend to lead to self-hatred. But he had a lot of depression. My mom had some depression. Like, there was stuff. And I was this sensitive little kid. I picked the stuff up. Yeah. Being able to recognize that and diagnosis. I turned out actually to have been given an ADHD diagnosis that I never knew about. Oh, wow. But I could not frame this, I didn't know, like, why is it that, like, stuff bothers the heck out of me and I feel the need to control it so that I can just feel okay. And everybody else just blithely goes on and it doesn't bother them. Yeah. Like, I just think, oh, well, I'm bossy and selfish and controlling, which I've been told at times as a child because I was behaving that way, but it was
Mm-hmm.
because I couldn't deal with the stuff, all the input.
Yes.
And so, when you kind of realize those things, kids can label themselves worse than any label you might decide to give them. So I would
Mm-hmm.
much prefer to have been labeled Aspie or something, because at least I would have known, oh, this is a complex syndrome of things. They all fit together. All this stuff that you have, like, is part of something. It's not Maya is a bad person.
Right, right.
Maya can control herself or whatever. So, I think, labels are difficult because the same kid, another kid might take like an Aspie label and be like, oh, well, I'll never have friends and I'll never do this. And it has
Mm,
limitations.
right.
Whereas like I would have taken it and been like, oh, wow, okay, this explains it. Whew.
What a
Uh,
relief.
yeah, yeah. And, a lot of, but this is why I'm sort of obsessed with the question of labeling and defining things,
Mm-hmm.
because it changes your brain profoundly. It changes how you interact with the world. Kids pick up these weird little things and they create a self out of them. And then,
Yes.
how you don't even know, because like I didn't tell anybody this stuff. Like it was
Mm-hmm.
nonverbal. So I think it's really important to sort of realize that little kids are creating this structure for the rest of their thought for the rest of their life, scarily enough.
Yes.
And that's terrifying to parents. And obviously nobody can be perfect, and you shouldn't try. But you know, it's just, this is the way humans grow and develop, and it's very interesting, and it's very sad and painful in some ways. And what we hope to do is allow people to develop with the neurology they have into the best version of that. Because the thing that
Mm-hmm.
I always want to mention too is that, like, all of these things that gave me all of this pain also
Mm-hmm.
gave me the talent that I have as a writer and the ability that I have to do whatever I do. So, I mean,
Yes.
like, if I hadn't had this oversensitivity, I could never have written the book. If I hadn't had the persistence despite negative consequences that was like making me shoot up 40 times a day,
Mm-hmm.
I would have also been able to persist through 10 million rejections, like, which
Yes.
is normal when you're a writer. Um,
Yes.
you know, um, so it's really, I think that, this is not to say that there aren't some disabilities that are just disabilities and have no pluses to them,
Mm-hmm.
but most of them, fortunately, have some good sides. And, the bug is also a feature. And use the
Mm-hmm.
bug as a feature if you're given the right environment in which to flourish. And, I think the disability rights movement socially, right? Like, if I want to go like this or whatever, right?
Yeah.
Uh, the That's only socially unacceptable because we make it socially unacceptable.
Right.
It's not because because there's something inherently wrong with doing that, right?
Yeah.
Um,
Yeah.
so, we need to be more socially accepting of diversity in people in every different possible way. And when we do that, that gives room for people to be how they are without, suffering horrible anxiety.
Mm. Well said. Well said. And I can relate to that on so many levels personally because I am a writer and I also have a younger brother who is on the autism spectrum.
Oh, wow, yeah.
So I can completely relate to this idea of just allowing the person to be who they are and finding their unique gifts and looking at it as this is one aspect of them, but it's not the entire picture. And
People's, like, for such a long time, people thought, like, oh, if we just suppress these repetitive behaviors, we just stop
mm-hmm.
people from, doing whatever they want to do that makes them more comfortable to stimulate themselves or calm themselves. Um, like, why? Like, it's
Yeah,
annoying to you. It's
right.
helpful to them, and okay, like, yes, we should try to minimize our annoyance of other people. But those other people should also have a little bit of tolerance for where we're at, right? Um,
Sure.
and, but I do think it's so important to recognize that if you accommodate disability,
Mm-hmm.
and you create environments where all types of people can flourish, you
Mm-hmm.
end up with just much better spaces for everybody. I mean, I'm going to say something
Yes.
silly, but like, restaurants today, horribly loud, really
Mm-hmm.
difficult for anybody with
Yeah.
sensory stuff. But also, other people actually like to talk in restaurants, and they don't have to be neurodiverse at all to like want that, right?
Sure, sure.
When you create, wheelchair ramps. Oh, gee, they also work for strollers.
Right, right.
Like, so,
Yeah.
it's really like when there's unexpected benefits to like being inclusive.
Mm.
Obviously, it's the right thing to do anyway. But I think it's always helpful if there's selfish as well as altruistic.
Yeah. Oh, completely. Completely. I
Right?
love that. My brother always goes out with the big noise canceling
Oh,
headphones.
me
And
too.
sometimes I want to borrow them because I'm just like, it is really loud. I would enjoy those. That would be helpful.
Yeah,
Um,
no, it's funny. Like I have me and my Bose noise canceling. I'm like walking down the street, always here in New York, and no, it's funny. Like I have to be careful not to always use them because then you get sensitized. It gets worse, so you have to like,
yes.
you know.
Yes.
But I mostly am like New York is seriously loud. I would prefer not to damage my hearing anymore.
Yes, and that's something our CEO, Joe Kelzer, tends to say that, I mean, every person who comes through the program is unique, but what they tend to have in common, he said they usually tend to be smart and they tend to be sensitive. And that's why they end up here and they're dealing with addiction, but also,
I mean, I think that's a really important and under researched area. Like
mm,
when I was working on the book, I was really surprised to learn about just how many people actually do have sensory issues that are
yeah,
not
yeah,
spectrum, or maybe they are and they didn't, or whatever, but mostly not. And how this, I don't think anybody has researched how sensory oversensitivities like play into addiction risk. But we now know that like being on the
mm,
spectrum and having normal to high IQ doubles your risk of addiction. Um,
wow, wow,
and so, this is only known very recently because I think in the
mm,
past, like studies of autism, we're looking at the most severely disabled where,
sure,
even if you wanted drugs, you probably couldn't get them.
yep, yep,
um, but so those who, can pass for normal as much as possible can also,
yeah,
and that can cause risk.
right,
So we
right,
need to, like, and I say this in the book, there was like, I was on a list of moms who, had lost their kids and they were talking about,
hmm,
oh, they needed the tags cut out of their under. It was like, I could have been on like an autism
yes,
list. And it was like,
yes.
oh, like somebody really needs to study this.
Yes, I wholeheartedly agree. And that's such a great point to talk about the sensitivity. And I love how you highlighted that in the right environment, these things can also be strengths because one of the exercises that we have folks do is working with their addicted aspects, but looking at the ways that those parts of themselves are strong and have been trying to help them. Like you were saying with the drive, the perseverance, the persistence, the tenacity, that if you can direct those in a functional and healthy way, that those things can be amazing strengths.
Yeah, no, and I think it's really helpful to look at it that way, especially when you've been so marginalized and so stigmatized and told so many times, oh, we don't even want to save your life because you're worthless. Um,
Mm,
which we're getting a lot of messages now about, and I just think about it, and the some of the people who you would most want to have in your world who are like artists and musicians and like just incredibly creative people tend to be sensitive. Now this can
yep.
also make them jerks, but also make us very creative. So it's important to sometimes I feel like when people talk about sensitivity, oh, I'm a sensitive flower, blah blah blah,
Yeah.
like it makes me good and special or whatever. Like I don't want to do that. I just want to
Hmm,
say
hmm.
like use it like productively,
Yes.
and
Yes.
it you can use sensitivity to be either very empathetic and supportive or to just go within and possibly be mean to other people
Yeah.
because you just can't deal. So it's like anything else, seriously complicated.
Amen. Yes. So I want to honor your time, but I'm so grateful to you for coming and for having this conversation with us. So, any final words of wisdom, anything else you wanted to share for folks who are listening who might be dealing with addiction?
I mean, I just really want to say that, most people do recover. Like,
Mm-hmm.
you just
Mm-hmm.
have to stay alive long enough to get there. And for most people, that isn't that long. And, it's like, by 30, half of all addictions are over. And
Mm-hmm.
most of the people are not dying of overdose. Most of the people are aging out and doing okay. So there is hope. And if you seek help and people are treating you with disrespect, seek help elsewhere. Like,
Yes.
that is not acceptable. It is not acceptable in a heart surgeon. It is not acceptable in an addictions counselor. Like, the way people recover from addiction is through love and connection and empathy.
Mm-hmm.
And that doesn't mean there's not any pain, but it means that we don't inflict extra pain in order to try to help you, which is not a good thing to do.
Yes. Yes. That's so well said. And it sums up one of the catchphrases that we tend to use is when we apply love to the parts of ourselves that hurt, we heal, and that we have that capability to heal.
Yeah, I think that makes a lot of sense. And when when you realize that, like, I mean, part of the thing that I think is so painful during addiction for a lot of people is that you like hate yourself for hating yourself, and you hate yourself
Yes. Yes.
change, and like it's this meta self hate that causes the unbearableness. It's like if you can get out of
Mm-hmm.
that loop and just be like, okay, I realize that this is not working. It's okay. I'm
Yep.
going to figure out something. Just unbearable and need anesthesia.
Yeah. I have a post-it note on my refrigerator that says, "It's okay. You're all right. There's no rush. You can do this." Just in
Yeah,
case it's like you
yeah. I
needed the
think that's
reminder.
yeah. That's a very good place to leave. I think.
Thank you. This has been a delight.
Thanks. Likewise.
Thank you.